In this special episode of the ASC Podcast with John Goehle, recorded live from the Washington Association of Ambulatory Surgery Centers 2025 Annual Education Conference in Tulalip, Washington, we interview some of the speakers and discuss recent activities for the association and discuss the benefits of membership in the association.
Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. We would like to thank our sponsors, Surgical Information Systems, providing cutting-edge information solutions for surgery providers, RFX Solutions, your all-in-one healthcare regulatory compliance software, MedServe, which is the only digital narcotic cabinet specifically designed and priced for surgery centers, helping standardize processes, compliance, eliminate paper logs and prevent drug diversion, and Ambulatory Healthcare Strategies, the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, please visit our website at ascpodcast.com.
Welcome to episode 260 of the ASC Podcast with John Goehle, recorded on November 7th, 2025, from the Washington Ambulatory Surgery Center Association's Annual Education Conference in Tulalip, Washington, and our studios in Spencerport, New York. I'm Sue Cronkite, your co-host and operations manager at Ambulatory Healthcare Strategies. As a reminder, the regulatory landscape for ASCs is constantly changing. The content in this episode reflects the most current information available at the time of recording. We encourage all ASCs to remain vigilant and keep up with any updates or new guidelines released by relevant regulatory authorities. Joining me today is John Goehle, owner of Ambulatory Healthcare Strategies and one of the leading experts in the ambulatory surgery field. With over 3 decades of experience, John has authored more than 10 books on the ASC industry, and he is a highly regarded speaker on topics related to regulation, accreditation, and financial management.
So, Sue, I've been continuing my traverses across the country. This time I visited Washington State for the annual Washington Ambulatory Surgery Center Education Day. Actually, a couple days. I actually spoke twice during the pre-conference on the Wednesday, which is the first time they've done the pre-conference, and judging by the attendance, it looks like it's going to be something they'll continue on. Had a lot of fun, got to meet a lot of our listeners. There's quite a heavy concentration of our listeners, Sue, up in Washington State. So, as we're recording this in the studio, recording the beginning and ending in the studio, our new puppy, which is 6 months old, is running around and acting crazy. She's never really been in the studio before. But I know that people are listening because they've been asked, the first thing they ask me is not about what's going on in the surgery center industry, but how the puppy's doing. So clearly we have a lot of good listeners up there. The conference was held at the Tulalip Casino in Tulalip, Washington. Wonderful venue. Actually, the space is just perfect for the size of the conference, and the food was fantastic. So if you're not a member of the state association or haven't experienced a conference in the past, definitely look it up for next year. Also, one of the things that was interesting, the relationship between the state association and the Department of Health in Washington is excellent. And the representative from Department of Health was there the entire time. And I think I've talked to her probably a total of over an hour and a half during that time, which I think is longer than I've talked to any state surveyor or somebody from the Department of Health. And we learned a lot about what was going on. We explained some of the experiences that we've had. And she also attended both of my sessions, and I attended her sessions. So just goes to show how interested the Department of Health is in truly understanding the industry and being involved and answering the questions of the attendees. She did a fantastic job in her conversations there. Also, Sue, I had an opportunity to talk to Michonne Mayfield from Quad A. She and I go way back. Michonne used to be with HHC. Now she works with Quad A. And she said something was kind of interesting. It doesn't really have much to do with the ambulatory surgery industry, but she indicated that Quad A has introduced a new accreditation program for med spas. And for those clients of ours and those listeners that have a med spa associated with their practice or even their surgery center, this is a one-of-a-kind opportunity for people to get their med spa accredited. So if you're interested in that, definitely go to the Quad A website, and I'll provide a link to that. Just thought it was interesting. I've already referred a couple clients to her to see if they're interested. I also had a lot of great interviews here, as we'll start introducing in a minute. The speakers were great. We had an opportunity to talk to both. We did something different, which I think we're going to try to continue on, is we're also trying to get the voice of the attendee here. So I think that was exciting to try to see what the attendees thought, because it's one thing to talk to all the leaders and the speakers, but to actually talk to an attendee and help our listeners, especially those that didn't make it to the conference, understand what they're missing there, I think is important. The vendor experience at the conference is always great. Again, we have a vendor that's speaking as one of our interviews. And I spent quite a bit of time in the exhibit hall and had an opportunity to talk to pretty much all of the vendors that were there. So let's start by having an interview with my friend Doug Beck. Doug is a pharmacist, and he does pharmacy consulting up in Washington State. He and I spent quite a bit of time together talking about various issues, not just local issues in Washington State, but national issues. And we try to spread out the conversations about pharmacy, but I asked him to do kind of a broad stroke approach to what's going on in the pharmacy area. So let's listen to that interview first. I'm here at the Washington Ambulatory Surgery Center Association's annual conference. I'm here with my friend Doug Beck. Doug, you and I met about 3 years ago here, and we became fast friends, and we spent a lot of time together. But my audience doesn't necessarily remember the last time I interviewed you. Can you introduce yourself?
Fair enough. Sure, yeah. Well, I think we got together really well because of the puppies. I think
that's true.
Right. So Doug Beck, I'm a pharmacist in Washington State. Got my degree at Wyoming, and then came back home here in 1990. I've been doing surgery center inspections for a little over 25 years now. And I think that's where we got involved together, is just being able to talk about some drug issues and concerns that we're seeing in the industry with pharmaceuticals. And yeah, it's been a good friendship.
It has been. And we talk regularly throughout the year, so it's not just once a year when we get together in person. And for those of our listeners that don't know, I know you hear a lot of different pharmacy consultants that are on the podcast. We have our shall we say, our favorite consultants throughout the country, since we're throughout the country. And Doug is our Northwest guy here. So
I appreciate that.
If you're looking for a great pharmacy consultant out here, actually, why don't we start with that? Because we just listened to we're here at the association meeting. We just listened to Christine Anderson, who is she's from the Department of Health here. She
Correct.
did a wonderful presentation. But one point that she made, I don't think you were in the room at the time, but she made the point that she goes into centers who don't realize that they have to have a pharmacy consultant. So two things on that. Why don't you talk about that requirement, then second, talk about what type of pharmacy consultant you should have.
Yeah, appreciate that. I was very shocked to hear that as well, because in our state, there is a Washington Administrative Code that requires ambulatory surgery centers to have a consultant.
Yeah.
They don't dictate how much time or the frequency that the surveyor or the consultant has to come in, but they do say you have to have one. So to understand that there are facilities out there that are functioning with a license, and that's shocking to me.
Yeah.
And it does not discriminate between a type of a pharmacist. You just have to be a registered pharmacist or a PharmD. But there are many cases where, the clinics maybe who initiated a surgery center are next door to, let's say, a retail pharmacy. And so they'll bring in that pharmacist, hey, can you come in and check for outdates and do the minor tasks that we used to probably do. And they can do that. I mean, they can certainly practice as a pharmacy consultant and perform the tasks that are required. What I found a lot of the times, though, we've talked about how there are physicians, but you have a physician who's a surgeon and a physician who's an anesthesiologist. And that anesthesiologist is not cutting on the patient.
Yeah, right.
I think the same is somewhat true with pharmacists. I really feel that to give the best patient-focused care, a hospital-based or a pharmacist consultant that has hospital experience really renders more to what an ASC is looking for. Just try to keep compliant with aspects of our healthcare that you're not going to see in a retail world, like the USP 797, sterile compounding, immediate use. So that's my suggestion is if you are looking for one, try to get a pharmacist that's had some hospital experience.
Yeah, and again, we're not putting down, retail pharmacists. They do a wonderful job for, healthcare, and that's important. But to your point, having somebody that's knowledgeable about hospital, and by the way, even more specifically, you, for example, specialize in ASCs too. I mean, I know you're in the hospital environment, but ASCs are one of your areas of expertise, and there's unusual things that you need to be aware
and
of.
Listening to your podcast, put a plug in there for you. I mean, I'm hearing things from different aspects, consulting with the DOH, Christine, and our Washington Department of Health inspectors, and just seeing what they're experiencing out there. And then, yes, I'm in the hospital now, so I get inspected by Joint Commission myself, so I know what it's like to be on that other side of the coin, shall we say.
So we were talking earlier about some of the frustrations we have that when we go in, both you as a pharmacy consultant and myself as a regulatory, consultant, we really refer to ourselves as specialists, is that there's a frustration that we observe things that might not be caught by every surveyor out there. And I get it. I did a presentation yesterday. I know you came in a little bit late and you didn't get to hear my wonderful presentation, but one of the things I talked about is how you can't fall back on, well, I've never been cited for that before. Or, the surveyor was just here last week and he didn't say anything about pharmacy. And speaking as a surveyor, I get it. There's so many things I have to look at. I'm given a limited amount of time, and especially, I'm an administrator type. I'm not a clinician. I certainly don't know much about pharmacy. I might not catch all of those things that certainly you would catch out there. But the next guy that comes in after me, they might be an expert in it. So you've always got to be prepared for that. But so let's just talk about that for a second, because, I think you've heard and I've heard, well, I'm not going to worry about that, John or Doug, because I've never been cited for it. What do you think about that attitude?
Well, it's interesting because, again, one of your most recent episodes that you had, for example, the gentleman the pharmacist from California, he talked about biennial inventory records. And this is a DEA requirement. Every registrant through the DEA, it's a requirement in the Title 21 or Chapter 21. Yeah. So I'm not creating the rules, but
I as a surveyor, are not going to be looking for the biennial, but
that's my responsibility. So if you look with the WAC states, and the WAC is geared in our state anyways, based off of what the Pharmacy Quality Assurance Commission says, so our Board of Pharmacy, if you will. So I have to follow what they're saying and then impute that into the ambulatory surgery centers. So yes, I think there's many times that I come into a center, especially on the first or second go-round, where I bring up an issue, and the biennial is a perfect example. Just recently I had a facility, and they were just shocked. They'd had been in business for 18 years, multiple surveys, and nobody brought it up. Well, I guess,
too bad, so sad.
Buy a lottery ticket. I don't know. But I'm here. My goal is here to try to everything that I possibly know, and I don't know it all either, and I'm learning things every day, but I'm trying to make sure that from a pharmaceutical safety perspective, we're meeting the bar, if not exceeding it, so that when you as a surveyor from AAA or Christine from the Department of Health comes in, at least my client shouldn't have to worry about the pharmaceutical end. I can't speak to life safety or peer reviews or 6-part folders. I mean, that's outside of my wheelhouse. But so it is very well possible that I identify something that just hasn't been picked on before. But I can point to where the reference is, whatever the citing, if it's DEA or CDC or AAA, if this is what the standard is and I can cite that and we're not meeting, then let's just come together as a team and let's make sure we're there.
Yeah, and to your point, too, is that we know that the Department of Health is going to come out regularly. We know that your accrediting organization is going to come out regularly. You don't see OSHA showing up regularly. You don't see the DEA showing up. As a matter of fact, usually those two show up when you're in trouble. And the fact that they've never cited it before because they've never been there before isn't going to be your defense.
Fallback defense.
No, you're going to pay a penalty, and it could be even worse.
Right, because the DEA can assist fines, and I think our Board of Pharmacy, the Department of Health can as well. At least the rule is written as such. It sounds like there's still some work that needs to happen, but financial repercussions as a result of you not meeting the standards is certainly a possibility.
Let's actually address that issue quickly here, because I don't think any of the other speakers really talked about that. There is a new, and this is in process right now, but there is a process that's going into place that will allow the Department of Health to assess a fine for continued noncompliance with certain regulations.
Right, a second offense, from what my understanding
That's
is too.
ours
And
too.
I don't know the exact law or the WAC that they're referencing, but I think it's there. But look, I mean, we should be prepared. Yeah, exactly. So you're not down. If you're in that hole, then we've missed something.
And our point being here is how important it is to listen to your consultants, even if you've never been caught on that. That's my slide decks and your slide decks always talk about
Absolutely, yeah. They need to be coming in, and given your consultant the availability to search as well. I mean, I go in. I was actually taught a while years ago from a Joint Commission surveyor that they were instructed every closed door they open it, every closed cabinet they open it. I do the same thing, and many times I'll have my colleagues or my clients that maybe will push back a little bit. Well, that's just a blanket warmer. Well, if I can find something because of my experience to help you not get in trouble, then that's my goal. And if we see stuff and all of a sudden you recognize, well, that drug's not supposed to be there because it's in an unlocked cabinet, but Department of Health is going to find it just like, it's better that I find it when I don't have a badge versus somebody who can come in and levy either a fine.
Or when something bad happens.
Or when a patient, sentinel event. We certainly don't want that. Absolutely,
You bring up a good point. Let's talk about that for a second because I don't think we've addressed that recently. We talked about drug diversion a lot on the podcast. And albeit you and I talked about that before. Yeah. That's a big issue. I think we've probably almost beaten it to death, and we probably still have to talk about it. We don't have, but let's talk about security of drugs because there's some very specific regulations about making sure it's not just the narcotics, which really have a much higher level, but all drugs have to be locked up or secured in such a way that unlicensed people don't get access. Can you talk a little bit about that?
Yeah, sure. I mean, the one thing I think it might be a caveat is IV fluids. I don't see the Department of Health here calling those out, so we might have those in a storage room unsecured. But you would also acknowledge that Baxter and ICU Medical and Bebron, they have overwraps. So at least the drug solution is secured in that manner.
Yeah.
But when you have items that are stored in a cabinet that are unsecured, that in the evening, the EVS folks that come in, environmental services, come in and mop the floor or do your terminal clean, they have access to it. That isn't going to fly, and you're going to get in jeopardy for that.
And there's a lot of non-licensed people that are going to be in your facility on a regular basis anyway that really have they should not be anywhere.
Specifically weekends, if you're going to have a new electrical panel worked on and electricians are in there, or if you're having painting done. I mean, this is a thing that we talked about recently too, that in an IV room, an OR room, a clean environment, we need to be focused on, are there chips in the walls? I know that's not necessarily pharmacy driven, but because I am an IV specialist, I also look for that. Is there microbial growth that could be in there? So painting that, making sure there's no rust on your anesthesia carts. Really, I know we're changing a little bit of topic, but dirtiness in an IV room or OR room has really just been a problem lately that I've been identifying more frequently. Hair inside the medication drawer as you open it up, or sprayed or oversprayed drugs from improperly pressurized vials, and the needle's withdrawn and all of a sudden it sprays all over. That needs to be wiped and cleaned and disinfected before the next case, preferably, but certainly before the next day.
You made a good point. You and I talked about this. We had a long conversation before this interview. I feel like we're rehashing things that we've talked about extensively. But I think I shocked you when I showed you the number one CMS citation for 2025 was a sanitary environment. And I've kind of struggled when I talk to the audiences about that because it's not really been my experience that the places are filthy. But you said that but I'm not always looking into drug cabinets, like you are. So that was kind of interesting.
Well, and refrigerators, I frequently will find, and the problem with the refrigerators, it's a relatively dark environment when it's shut. It's moist.
Yeah.
And not always are they in the parameters that they should be in. A big pet peeve of mine is dormitory refrigerators. We see these frequently where they have a freezer section in it and then the drugs are stored directly underneath it. Well, manufacturers give us the marks. It's 36 to 46, and I'll use an infrared gun to double check the temperatures of the refrigerators or the warmers where the IV fluids might be kept.
Yeah.
It is not uncommon that those are out of spec.
We did address that in a recent episode where we talked about if you're storing any types of medications in a refrigerator, you really should have a medication one. And there appears to be regulatory guidance in that regard. I'm blanking on it right now, but you might want to look back at a prior episode. Maybe I'll try to find it for the show notes here to refer back to it. Let's talk about USP for a minute. 797 first, and then we'll talk about 800.
Okay, sure.
Because there's been some minor changes to USP 797. And the whole issue about having, proper signage and so why don't you talk about that?
Yeah. So 797, actually there was the new release of that was pretty robust, really. In particular with surgery centers, the area of focus is the immediate use terminology. Right. And there's a lot that goes into that. You have to have proper documentation, i.e., policies and procedures. Mm-hmm. You've got to document that you're educating your staff on proper hand hygiene, proper cleanliness of the designated area that you're going to be compounding the drugs. Mm-hmm. And I would say that there's also an auditing component to that where we should be demonstrating and then having them repeat back the demonstration, but then periodically just observing from a distance. Are they doing all the techniques properly? We have a 4-hour window now when we compound products, but that doesn't mean that you still don't have to label the syringe. In fact, you do. You need to label it with the concentration of the drug, the time and the date that you made this preparation, and the initials. And then you're supposed to have the expiration time on there as well. So if you did it at 0900, then it should be done at 1300.
Well, and that drug, if you're pulling it up and you keep storing it into the patient care area, forget the time frame. You can't use it on the next patient anyway.
Well, that brings another problem. Multi-dose vials. I know we've talked about it. ISMP's talked about it. The CDC's brought it up. American Systems of Healthcare Pharmacists, ASHP's brought it up. Multi-dose vials in a direct patient care area are not allowed.
And it becomes a single dose.
And it becomes a single dose. Correct. But you should not identify a bupivacaine multi-dose with 28 days expired when it's in the anesthesia cart.
That's right.
You can't do that.
So why don't we talk about succinylcholine? Because that's one of those drugs that often is mislabeled or not handled properly.
Absolutely.
Can you remind our audience?
Yeah, so again, that class of drugs, rocuronium, succinylcholine, are the two predominant in an ambulatory surgery center, are part of the class of neuromuscular blocking agents. The governing body that really oversees the safety of those is ISMP. I mean, FDA, you could say, but ISMP directs us on how those need to be handled. Proper storage of those in a refrigerator. It should have a lidded, separate container, clearly marked as a high risk, high alert. And when that drug is removed from the refrigerator, succinylcholine has, according to manufacturer guidelines, 14 days that it can be stored at controlled room temperature. Rocuronium gives us 60 days. So you've got some leeway there. However, once it's removed from the fridge, it needs to stay at room temperature. So you can't take it out and take it into the anesthesia cart and then put it back in the refrigerator at the end of the day because you didn't use it.
So I just learned something new today myself. That's interesting.
Changes of temperature gradients affects the pH of the drug, which affects the effectiveness. So you cannot do that. So once it's removed, it should be properly labeled, removed from refrigerator on this date at this time. 14 days, expires at this date, goes into the anesthesia cart. Now, 2 days later, the anesthesiologist needs that drug for the patient care, accesses the vial, it's one and done.
That's right. And let's remind our listeners, too, if you're using succinylcholine, of course, you have to have
malignant hypothermia. Yeah.
Right. I think everybody knows that, but it's a good.
If we could touch on that, because there's a few things that you got to make sure that you have the proper supply of it, and you can't say that you're going to share with the surgery center. At least in our state of Washington, you have to have the full supply. It is my preference that we use Ryanodex. I know that it's a cost gradient that a lot of people don't want, but I had an anesthesiologist show me how with 5 mils, which is the loading dose, they were able to totally abort emergency crisis. They corrected it and got that patient safely to their institution. Another provider said, do you realize, Doug, at my institution, we use 22 gauge needles. And if I have to push that much volume of dantrolene, I'm probably going to blow that line. And now I don't have access to being able to save this patient. So there's a lot more activities involved in malignant hyperthermia that we need to think about. And while if you go to M House, they're going to tell you dantrolene is approachable. I spoke to the physician that's part of that group, and he said, but of course, in my facility, all we use is Ryanodex. Yeah. So I'm not here to plug that company, but if you think about emergency crises like that, when they do happen, you really want to try to be able to create a scenario where success is evident quickly.
Yeah. Well, and I've actually been part of a drill And even though I'm not a clinician, they wanted me to
Mix it?
Oh, yeah. It was impossible.
Yeah.
It was impossible. Not to mention, as I'm watching that mixing going on, those needles are flying all over the place. And I'm thinking, this is ripe for, people could have gotten stabbed because they're moving so quickly.
Yes.
It was just
There are
ripe
ways so for my teams, my clients that refuse because of the cost, then there's stopcocks that you can put in. You can get liter bags, but it's, again,
you're in a crisis.
At a big hospital, we have a code team that they will come in there. You have pharmacists, you have nurses, you have pharmacy technicians that can mix. In an ambulatory surgery center, you really are in jeopardy when you don't have the team there to be able to help support in a crisis when you need it. So, that's a concern.
Let's talk about USP 800, something that people are not really following up on right now, or sometimes not even aware. Can you just quickly talk about the requirements?
Sure.
I know it doesn't affect many surgery centers,
Correct.
but you still have to do it.
Many it doesn't. I think the thing that we need to focus on there is that your consultant in particular should at least be addressing that on their report, acknowledging that he or she has looked at the formulary to identify if you have any of those. Right. They don't all have to be chemotherapy. There could be other agents that are fetal issues, DNA changing issues. So the consultant pharmacist should at least have a questionnaire saying, are you checking for those USP 800 drugs? And if you don't have any, at least I put it on my report. This facility doesn't utilize them. If they do utilize them, you're right. There's a whole ball of wax that comes into that. All your policies and procedures, closed system transfer devices. There are some products out there that are prepared and are ready to use closed system transfer, and they're sterile. So in that case, you can mitigate a lot of the responsibility required that like a hospital, for example, or a chemo infusion suite, all the policies that would be required for that. But you should be looking at it. And then if you do happen to have, even if you use them, the ready-to-use products, you've got to make sure to have training so we know how to properly put on the PPE that's related to it, double gloves, face shields, gowns, and then spill kits. One of the things I think I do see frequently that a spill kit's not available, or maybe it's just the blood spill kit but doesn't have all the proper devices that are used to contain the drugs that might fall on the ground.
Yeah. So I think the big takeaway on this one is that you really want to make sure that that there is a risk assessment done. And to your point, that doesn't have to be a complicated form or anything like that. Just
correct.
But it's got to be. It really needs to be done by a pharmacy consultant.
I think so.
Say. Yeah. I think that's difficult.
And then that should be presented to the governing board
through the quality improvement committee.
Exactly. Yeah.
And lastly, we're kind of rushed for time because we got a lot of things going on. Let's talk quickly about pharmaceutical waste.
Yeah, pharmaceutical waste. A lot of governing bodies that oversee that: Department of Ecology, Environmental Protection Agency, your certain state and local facilities as well. I think one of the biggest findings that I see is in a sharps container that folks are dumping bupivacaine vials in there with still pharmaceutical products in there. Yeah. My understanding is that those sharps containers are treated with radiation, so it kills off microorganisms, but then it just goes to the landfill. That pharmaceutical waste is still an active drug product that's in there, so we're not handling that correctly. So we need to be very conscientious about those. Need to go into black bins, separate those out. If you have an ampule that's been broken, like an epinephrine, that's a sharp, so that can go in there, but we should draw out the medication and make sure we're handling it properly. Also recognizing that these governing agencies can come in and levy fines. Yeah. And I think that's something that doesn't happen very frequently. It's documented. So it's best practice. Expensive. My suggestion there is that, work with your pharmacy consultant as well as your pharmaceutical waste contractor and make sure that they have you set up. This is another interesting point. In our state, you can commingle drugs. So you can put them just in one container. You don't have to separate out the RCRA drugs from the aerosolized albuterol, for example. But you have to be signed up with the state in such a manner. So that needs to come through your pharmaceutical waste, or Stericycle, Clean Harbor, whoever it happens to be, Waste Management.
Right.
Yeah. Trilogy.
Doug, we have to get back to the exhibit hall. And thank you so much. It was, as always, a pleasure talking to you.
Yeah, it's great meeting you too. Thanks, John.
Thanks.
And next, I interviewed Peter Buffo with Pacira. And we talked about the vendor experience. Pacira is at many of the conferences, many of the state conferences, as well as ASCA. And, of course, their premier product is Exparel, which is used in many ambulatory surgery centers and is reimbursed by Medicare separately. So talking to him, we got a good perspective on what the vendor experience is at the conference. Let's listen to that interview.
I'm here at the Washington Ambulatory Surgery Center Association's annual conference, and I'm here with Peter Buffo. She's with Pacira Biosciences. Peter, introduce yourself and your role at Pacira.
Hi, John. My name's Peter Buffo, and I'm the account manager for Western Washington for Pacira Biosciences. Our main product is Exparel, which is a liposomal bupivacaine, and I believe this is my 10th time with two different companies being one of the supporters of the WASCA meeting. That's
wonderful. I've actually only been here about 3 years, and every experience I've had has been great. A lot of our listeners are actual vendors, who listen to the podcast, understand what's going on in the industry. They listen to the state association special conferences that we do anytime I can do a special episode. So I thought we would interview you to kind of talk about that vendor experience. And again, I'm a vendor here also, so I can add my comments about it. But, obviously, Pacira, I see you guys at a lot of the state association meetings. You're supportive of ASCA too. Your booth always provides a lot of great information. So let's start with, why did you come here? What do you find is an advantage of coming to a state association and being a vendor?
Well, one of the advantages for a state association is, number one, is size. It's not too big to where it gets completely impersonal and it's thousands of people everywhere. You get a lot of really good interactions. I think a lot more personal interactions with people because they're not stressed about the timing. They're not worrying about getting home or their patients, which is the most important part. And it gives us the opportunity to interact with them at a very, very base level.
Yeah, and there's a lot of interaction time. There's a happy hour later on today. We're recording on the second day of the conference, first day of the full conference, second day of the actual conference with the pre-conference here. This is not a very expensive conference actually. It depends upon the level of support that you have. But speaking to somebody that exhibits at quite a number of state associations, I thought it was a very reasonable price. I'm not going to say what those prices are. That's a negotiation that you have there. But what do you think the value for the money here?
The value side of it is the key component, and the number of interactions that you have, the quality of the interactions that we have, especially in a more private setting. Yeah, I think that is the real advantage to this, and that's why we've supported it for so long.
You and I were talking earlier about you and I have been around a while, shall we say?
Yeah, a couple more decades than I could admit.
Right. Yeah. You don't have a lot of hair, and mine's all gray, so clearly we've been here for a while. But we've learned a lot over those years, right? So for those that are somewhat new to exhibiting at an ASC conference, which is somewhat different, what do you think is what's an important lesson for those young ones coming into the industry?
Well, building rapport is not something that happens overnight. You've got to have those interactions, and you got to have those little wins. And I think leaving your customers, even if it's just a brief 5-minute interaction, leaving them with a positive feeling about it, that's going to pay down the road. What you do today is going to pay you in 3 months from now. That's how I used to teach my sales guys, especially new ones coming in off the street. Is you're really going to be working right now for what you will gain in the future, and that's the exact same thing here. You're building rapport, and you're building on your reputation, and that dividend pays out months down the road.
Yeah, we talked about that before we started recording that. We sell a very expensive product. We sell cheaper products too, but our bread and butter is an expensive product. It takes a while to sell it. We're not going to sell it during a conference here, but somebody might come back a number of years later, and you have the same situation. There's quite a bit of a sales cycle here. They're going to have many interactions with your organization, be it through advertising, one-on-one conversations at conferences, or maybe an actual visit from somebody. But it's not a product that you're going to, I love it, send me some, let me buy some right away.
Yeah, there's a little bit more that goes into the background of it as far as the support mechanism for it. And then also, are they going to be using it correctly? Are they going to be billing for it correctly? Are they going to store it correctly? There's all these little tiny details that need to be built in there. So I don't want to say I don't want an instant sale, but I would rather have a sale that's built up over several different meetings than one that's instantaneous, because your ability to make a mistake is increased if you're just jumping right into something.
I actually had breakfast with another one of your colleagues here who's on the revenue cycle side Talk about that, from how important it is to have some good representation from different parts, especially when there's in your particular case, your product is partially paid for by insurance companies or by the government. Correct?
Right. So we have the No Pain Act and we have the insurance companies that have come on board, but this kind of speaks to the overall larger patient experience. Mm-hmm. It's not just the day of the surgery. It is 2 weeks preoperatively, building up their knowledge of it, getting the pre-authorization if you need it, and then post-operatively making sure that it's billed correctly and coded correctly. Those are all little things that often get overlooked, but are incredibly important for the not just the success of the treatment, but the success of the product to be reimbursed, and shouldn't be putting any stress on the facility.
Right.
That's the key part. But you have to have all those things in line. It's not just the day of the surgery and that injection. It's what did you do 2 weeks preoperatively, and then how are you managing that 2 weeks postoperatively?
And I thought what's nice about having the three people that you have here is that they have different perspectives.
Yes.
And again, anybody that is exhibiting here, that's an opportunity that you're probably not going to get on that one-on-one experience you have in coming into the center.
No. That's the beautiful part. We can bring a lot of different, and we actually have a speaker coming in tomorrow who's going to talk about enhanced recovery after surgery, which benefits everybody here. And that's something that we do to not only promote the message of our product, but the style of procedure that we are promoting and the health benefits of that for the patient.
Yeah. You brought up another important point, too, is that supporting these state associations, let's face it, that's a very important part of our responsibility as vendors in the industry to support them and the mission that they have in order to provide education to the surgery centers.
Yeah, I mean, one of the things that we found, and I've agreed with this for a long time, is that a lot of the smaller facilities, they're not going to go to the large national meetings. They just don't have time for it.
Or the money.
So, or the money. And so getting together on a state level, it's a much more intimate affair.
Right.
You get a lot. I think you get a lot more real information out of it.
When I talk to some vendors, especially those that have not been doing it as long as you and I have, they see one of their current clients come up to the table and they kind of say, hey, don't waste my time. You're already buying my product.
Oh, no.
That's wrong, isn't it?
Oh, my goodness. No. Yeah. It's an opportunity for you, again, to build rapport and to solidify that relationship and probe for anything that might be going wrong. So you can take care of it before it becomes a snowball big issue.
Yeah.
So that is nothing more than an opportunity.
Well, and I'll give an example, too. My experience has been sometimes our current clients come up to the table and when they see all the other products we have, they said, I'm shocked, and it's probably not good on my part from a sales pitch side, is they say, I didn't know you did that. Yeah. That's another opportunity to cross that because they already bought your product. Now they already trust you, obviously, and now they learn more about your company and what you offer.
And I'm not bad mouthing any physicians or any of our customers, but this is not all they do. They obviously have 100 different categories of products that they're thinking about where we're only focused on our one. So there's always something more that we can teach them or maybe just reinforce for them that they may have forgotten, which is not their fault. That's not what they do for a living, our particular product. Yes, they use it, but in order for them to learn, they've got to hear it from us.
And another thing that I find important in that interaction with your current clients is they overhear the ones that are not clients of yours right now, overhear that conversation. I always find it interesting. Sometimes the best sales pitch comes from my current customers selling.
I agree with that completely. Yeah. Absolutely. So when they hear it from a peer-to-peer perspective and it's unsolicited, that is probably the most golden advice that they will ever be given. They'll look at it and say, oh my God, that particular physician is doing this or that particular facility is doing this. They're no dummies. They're doing well. Right. Maybe we should take a look at this well. Maybe this will help our facility. Maybe this will help our patients.
Yeah. Another part of this experience in coming to the conference is not just what happens at the booth, but what happens at the dinner table or at the cocktail reception when you're walking around. Don't stick to
around the water cooler talk, so to speak.
Yeah,
and a lot of that doesn't have to be centered on business per se, but who you are as a person, what type of person you are. I don't know too many people that will do business with people they don't like.
Yeah, that's a good point.
So it's not about building a false relationship, but having a level of rapport where they know you, they recognize your face. You're not an unknown entity. You're an asset, not an ass.
Right.
So,
That's good.
so that's my mantra.
And I think lastly, I find there's always a lot of time when the attendees are in sessions and we as vendors, walk around and talk to each other. And I find that can be just as valuable. Those other relationships, you and I just met, talking about that. We obviously have a lot of cross dealings with our centers and their interaction with your product, as well as, needing to understand the revenue cycle impact of it. So those types of relationships are just as important, and sometimes even more valuable, because, you have access to people that have a lot more reach than the individuals that are showing up, that are here at the conference.
Absolutely. There's so much intel to be gathered, and there's so much knowledge to be shared, but also you never know. You might be hiring that person, or they might be hiring you.
That's a very good point.
10 years down the road, who knows? But there's the always be closing mantra for salespeople. Well, ABR, always be recruiting.
Yeah, right.
If you're always recruiting and looking for that next person, or that guy's really good, or that lady's really good. Yeah. I want to keep in touch with her or him, so that down the road, if we need somebody, or who knows, maybe if I'm looking, it's a two-way street. So.
Yeah, no, that's a very good point. I don't think anybody's ever brought that up before, but that's a very important point. I think I find that these conferences are just an incredible. I always walk away very upbeat. After them having that interaction, and I really start to feel like we are in a very special industry.
Yeah, absolutely. I agree with you completely on that. The ability to sit down and talk and relax, in a sense, and not have that TikTok in the background, or the patient in the background, or some meeting that's coming up, or just trying to get home to your kids. It provides an environment where you can really build some good trust and confidence.
Yeah, and Peter, you work in multiple industries, not just the ambulatory surgery industry, right?
Oh, no. Ambulatory surgery is about 40% of our business. 70% is actually large hospitals.
But I think you would agree with me. One of the things that I find when I come to a conference like this is it is important that the attendee knows that even though you might have business in other types of healthcare facilities, you really know the ASC industry. Don't come to these conferences and start talking or bragging about the fact that you have a heavy hospital presentation. We want to know you're dedicated to our industry.
Oh, yeah. And more importantly, it's enhancing your industry.
Yeah.
We're actually trying to help your industry grow. The Ambulatory Surgery Center environment has grown exponentially in the last 10 years. And I think it's going to continue to grow in the future. It's a much more personal setting, much more specialized setting, and I can't say enough about how glad I am that it has done so well, and they've really turned out a fantastic product, and on multiple levels.
Yeah, and you bring up another important point here, and that is the importance of understanding as a salesperson that you're not selling a product, you're selling a solution. I speak about this a lot on the podcast, and when I talk to other vendors, is that we, especially in the industry at ASCs in particular, we don't want you coming up and giving me that elevator sales pitch. Right. We want you to help us to understand how your product, and certainly Procera's product is a great example of this, how your product is really so important to solving an ongoing problem. In your case, of course, the issue of opioid drugs, and pain management.
Yeah, it's not just that, it's also the time savings, patient satisfaction scores, I would say reducing the workload.
Yeah.
That's a huge deal. When you start adding up the minutes that are spent on different things by people, every single one of those people is paid by the hour.
Right.
So at some point, if you can reduce time, that is a massive cost savings.
And that's your sales pitch.
And that's the one thing you can actually give them. We're going to give you more time. We're going to give you better patient satisfaction scores. We're not going to have to worry about your product.
Yeah. That's the sales pitch. That's how you sell your product to the ASC industry. Peter, it's been a pleasure talking to you. Thank you so much for your time.
Thank you very much, John. Yeah, absolutely.
It's been a long day, and the surveyors just left, and you are exhausted. And looking at the list of items that you have to address, you wonder, how can I deal with this and still take care of my patients? More importantly, you wonder, how can I ever keep up with all of the regulations, standards, and accreditation requirements? How can I always be prepared for a survey and reduce my stress levels? Well, that's what Ambulatory Healthcare Strategies does, day in, day out. We become your outsourced regulatory and accreditation resource. We can maintain your policy manual, develop your education programs, help out with fire and disaster drills, do your risk assessments, oversee your quality improvement activities, help run your quality improvement meetings and governing body meetings, and we can even prepare your monthly or quarterly financial statements and help you figure out where you are financially. We are a retainer-based service. We don't take ownership. We don't charge based on your revenue. We have one fixed monthly fee, and we can tailor your services to your exact needs. So whether you're looking for help getting over a survey, preparing for a survey, or looking for a long-term relationship to assist you with your ongoing regulatory and/or financial needs, please give us a call at 585-594-1167 or email us at info@ahstrategies.com. That is info@ah-strategies.com, or visit our website at ah-strategies.com. Next, as we always try to do, we talk to somebody from the board of directors, and this time we talked to Sylvia John. She's a very active member of the board of directors, and she talked about her experience on the board as well as the activities of the organization at the present time.
So I'm here at the Washington Ambulatory Surgery Association's annual conference. We're at the Tulalip Resort here in Marysville, Washington, and I'm here with Sylvia John. She's a member of the board of directors, and I've asked her to talk a little bit about the board here, a little bit about the leadership in the organization and where the organization is right now and what they're heading. So Sylvia, first of all, please introduce yourself.
Hi, yes, I'm Sylvia Johns, VP of Surgical Services for Olympia Orthopedic, and I've been on the board of directors about 7 years now. It's hard to believe it's been that long. And I was invited from a colleague, Jamie, who is out in Poulsbo, and she's been an active member for several years. It's been a really great experience to learn the ins and outs of what the association does for surgery centers specifically. There's a lot of advocacy work that happens, not just the meetings that we attend, although those are very helpful in navigating the arena. There's a lot of work that happens behind the scenes in terms of trying to get our lawmakers to understand what ASCs are, how we serve our communities, and the value that we have from a quality and patient care standpoint.
So Sylvia, I talk at a lot of state associations. I think if I do the math, this is my 12th this year. I have one more to go before the end, and I love coming up here. First of all, the venue is beautiful here at the Tulalip Resort. It is a casino. I'm not a big fan of casinos, but they really have wonderful space. The hotel is nice. It's a great space for exhibitors here too. Like so many board members, 7 years, that's actually kind of low for some board members of some of these associations. What have you seen change over the last 7 years? Of course, at 7 years, you've been here during the pandemic. What have you seen from the organization you first joined on the board to where you are today?
I would say the biggest thing from my perspective is the relationship that we've built with Department of Health. Yeah. From a survey standpoint, the relationship, just them hearing our feedback and really taking what we're saying seriously, some of the barriers and frustrations when you have a surveyor come in and maybe they're more punitive in their tone in the way that they are coming in and speaking with staff. And I really feel like that whole dynamic has changed tremendously over the years with the work that WASCA has done with Department of Health directly. And it's really nice to see that when a surveyor comes in, it's more of an education and learning and really quality focused versus the staff being fearful of I gotcha kind of thing. Yeah. And so that mentality and that whole thing from the time I started in 2015 to where we are now, I feel like has changed a lot. And that for me is like the biggest change, I think, through WASCA that I've seen is that advocacy and kind of pushing back and sharing feedback from the experiences of folks in the ASC in the intent of surveys, right? It's to learn to do better.
It was interesting. I think I spent an hour talking to Christine Anderson. She was the speaker here.
Yes.
And actually I just attended her session here. And interestingly and fascinating, she's been here for the whole conference. She actually attended my 2 sessions on survey prep, and which never happens. I mean, usually if the Department of Health is coming in, they're jetting in and jetting out. And I just had a delightful conversation with a very different attitude here. And,
Absolutely.
And it sounds like they're very good at, just to consult with, talk to. Obviously there's always that dynamic of, they have a regulatory oversight requirement.
Absolutely.
But it is nice to see that your Department of Health really does know your industry well, and they're approachable. And I think so let's talk a little bit about your conference here. This is my 3rd year speaking here. I love coming up here. You got a great audience. Ask a lot of questions. I always run out of time. Did you attend my session yesterday where... Yeah.
I wish I did. Actually, I didn't, because I was introducing speakers in the other classrooms.
Well, I only got through 3/4 of my slides, which is fine, because people see the slides later, and when there's good engagement. And there's sometimes you go to state associations where, people aren't asking those questions, or there might be some hesitancy. There was no hesitancy here there. So talk about what goes into putting together the conference.
Yeah. So first off, we take feedback from each year, because it's important to us that we're listening to people who are attending and that they're finding value in being here and taking the time off to be here and traveling here. We know it's a busy time of year, and so it's a lot to ask folks to come. And, we focus on the real problems that all of us are dealing with. So it's great to see when you're in the room with other people that they're nodding their head and they're going, yes. And as you have these small opportunities to network with people outside of the classroom sort of environment, is that you're talking with people that can relate to the real problems that you're facing, whether it's an anesthesia shortage or staffing shortage, or just how you communicate better on your team, learning what's coming from a regulatory standpoint, and understanding and being prepared, really. I've learned a lot of new things just in the first few hours this morning of things that are coming and changing. And so it just really helps us be prepared.
What do you think? Let's talk about the benefits of membership. There's still a lot of people out there that are not members of the state association here, and we want to encourage them to become members. And this is what I say a lot. And unfortunately, my dear friend Bill Prentice will be here later on from ASCA, and he'll probably disagree with me on this. But I've always said, if you have a state association, join the state association. If you have money left over, and I hope you do, join the national one too. But it's so important to be involved with the state association. Talk a little bit about the benefits here of state association membership to people that might not currently be members.
Sure. So in my opinion, there's a lot of benefits. As a non-member, you get some benefit, but not as much as a member in terms of access to resources online, discounted rates on courses, the spring seminars that we do. We've started an infection prevention seminar the last 2 years, which my staff have just raved about, which I think is of great value for your quality team and understanding infection control and all of those things. So you get access, discounted access to those events. You also, just the networking. I think that as a member, people are more willing to share openly with members versus non-members. And then you also get the inside information as to what's coming. So we send out communications frequently about new laws, new updates, things to be prepared for. And not only that, I think the biggest thing to keep in mind is that as you contribute to your membership dues, all of that money goes towards advocacy and working on behalf of ASCs, specifically in Washington State. And it's really important that we have people that are speaking on our behalf, because we can't step away from our centers and do it, to the lawmakers who don't necessarily understand what it is we do. We're not hospitals. We're completely different. We're not an HOPD. And so our lobbyists are folks that are working on our behalf, that those membership dues go to help advocate for us to just, keep laws in line that help support us.
So before Christine talked from the Department of Health, Emily Studebaker talked. She's your legislative person here at the association. She also is a lawyer and talks about legal things. I think one thing that I find interesting, we have a couple clients here in Washington. This is a difficult state. I'm not going to say it's more difficult than other states, but you have some unusual regulations and, of course, a lot of legislative things coming up. So I do think that with the advocacy, that comes from the members here, your participation, this association's participation, and Emily's assistance, it's very important that you are on top of what's going on. For example, when Emily was speaking this morning, there were things that people in the audience knew nothing about. And then I talked to Christine, and she's shocked when she comes in and people don't realize that there are specific regulations that they were not aware of here. So to stay on top of that sort of thing, you need to, first of all, be a member, but also come to these association meetings where you can talk. Let's also talk about another thing I find fascinating. It's important to come to these sessions, these programs, to listen to the sessions. Mm-hmm. But let's face it, I think that's half of the reason for attending, isn't it? What do you think?
Absolutely.
Don't you agree that that interaction?
I think, when I was brand new in this arena, making connections to people that could help me understand this field, this different beast, if you will, was so valuable. Yeah. And I made so many connections in the first meeting that I went to. So the networking has just been a tremendous help from an administrator standpoint, because then you can talk to folks offline. People are more comfortable and willing to share, hey, what policy do you have relating to X, And so we've made a lot of connections, a lot of friends, and vice versa, where we can share things. Even today, I've met, at least 5 new people, and I gave them my card. I said, let's keep in touch, So the networking is of great value. I don't think we get many opportunities to do that. Yeah. In addition, meeting with these vendors, I don't know about other administrators, but I personally don't have time during the week to sit there for hours and hours and just meet with vendors. But in this setting, you have opportunity to really go in with specific questions and say, hey, this is what we're dealing with. We're looking for C-arms, or we're looking for gurneys, new gurneys. And you can get information and be very specific about it and target who you're interested in, and really hone in on those vendors and make the time valuable. So I do think that, this conference, in addition to the courses, there's those other opportunities that I would say are equally as valuable.
Yeah, I'd agree. I think that's really one of the major things, one of the advantages of coming to a conference like that. And you talked about the vendor experience. I'm going to be interviewing one of the vendors here, and we're vendors here. This is the first year. Yeah. So one thing I'll tell you, a story of our vendor. We decided, I think it was 2 weeks ago, I think we wanted to be a vendor, but we forgot about it, so we forgot to fill out the paperwork. You still processed it very quickly. So we must have been the last one, since we had the last booth on the one icon corner. Still a great location and great interaction. So for those of you that are listening, that are vendors that are considering, sponsoring, this is a great opportunity. It's a great. I see really great interaction between the attendees and the vendors here. So, and personally, I thought it was a very reasonable price for us to be here, and we'll be back again next year. We've already decided, just because of the good experience. So let's face it, right? The vendors help pay the bills, don't they?
They absolutely do. But I think it also, time is limited for everybody, and I feel like this helps target and zone in on really valuable opportunities, not just people wanting to stop by and get a stamp because they get a prize, but really honing in on clients that are either new clients or connecting with existing clients and getting feedback, pros and cons about how things are going and how to do things better. But I think it really does help maximize that time, the limited time that we all have, even from a vendor perspective.
Well, and even if you meet a lot with your clients while you're here, those clients can talk to other people that are coming to your booth and tell them what a great experience it is. I'm just as happy to talk to my clients as I am, people that don't know our services. So, Sylvia, thank you so much for your time. I really, and again, I just want to thank you for a wonderful experience here so far. You're my first interview, but I know everybody that I've talked to so far has been very excited about the conference. So we'll be back.
Yeah. Well, great. Thank you for having me, John. I appreciate it. And anyone who gives it a try to come to one of our conferences, I know that I guarantee you will have a great experience and you will meet a lot of new people that can share in your experiences and offer feedback and resources. So please come out.
And we'll provide a link to your website and the membership website in our show notes. So again, thank you.
Thank you.
And as John mentioned, he did something a little bit different this time and interviewed an attendee. So next, let's listen to Alyssa talk about the meeting and the organization and her experience.
So I'm here at the Washington Ambulatory Surgery Center Association's annual conference, and we're at the Tulalip Resort here in Maryville, Washington. I'm here with Alyssa Bean. Alyssa is an attendee here. Alyssa, why don't you introduce yourself?
Yeah, so like John said, I'm Alyssa, and I have the privilege of running 2 surgery centers here in Washington, Seattle Surgery Center and Pro Medical Surgery Center. And I work for SCA Health.
So, Alyssa, you've been coming for a number of years, haven't you?
Yeah, I think this is my 4th WASCA.
Why do you keep coming back?
I think it's a great time to check in with what's new, network with, you kind of meet friends here that you see only once a year. There's actually a lot of great content in a pretty succinct amount of time. So I think it's very worthwhile. It's really a day and a half or 2, and you get away and you do something for yourself and your own professional development. We're all insanely busy. Every single person here is busy, and it's a commitment to come, but I think it's very worthwhile.
So why did you come this year? Did you looked at the agenda, and was there anything in particular that you saw on the agenda that you were excited about hearing? Other than listening to me speak, of course.
I mean, clearly, I saw that you were on yesterday, and I thought, can't miss it. No, I think what I enjoy is that there are some repeats. Now stay with me here, because that sounds like it's not great, but our local legislature does have updates. The state regulations change all the time. We get surveyed. It depends on where you are in your survey cycle. It's great to have a focal time to just listen to the actual surveyors tell you what they're looking for. It's sort of like a one-stop shop. So this year, I was happy to see familiar faces and a couple new keynote speakers. And I just, I look forward to you. I think embedded within the agenda, you get more information, and an agenda only tells you so much.
Yeah, that's a good point. And I just attended the last 2 sessions, which were from Christine Anderson. She's with the Department of Health, and before that, Emily Studebaker, who is a lawyer that works with on legislative issues and regulatory issues here. And both of them were great speakers. And particularly, I enjoyed listening to the Department of Health. Emily, I've heard many times before, but this is the first time I've heard Christine talk. It's great to hear a Department of Health person who's coming in and is really trying to help you. Didn't you get that same feel for her?
100%. And full disclosure, I've worked with Christine. Yeah. So I really enjoy seeing her authenticity, with her speaking as well. Because she presents that way when she comes to your center. Just very real talk, knows her stuff, wants to help, and is engaged in the safety of the patient and the operations of your center.
She's passionate about it. I spent an hour talking to her this morning, and she attended my sessions too, and I attended hers, and we supported each other there. But I think for those of you listeners out there that have never been to a state association meeting, that alone is worth the time. I mean, there's so many other things that are beneficial here, but hearing in a non-threatening environment, that person's going to be showing up in your doorstep at some point is invaluable.
100%. And Christine's a nurse, and I'm a nurse by background, so I will tell you that some of these regulatory and legislative things, as a nurse, it's not been in your wheelhouse. And I do think that WASCA does a great job of bridging that gap and informing in a manner that is of interest to you, even if your background is a nurse or you're an administrator, or you're in materials, you're in the business office. I think it's a great global understanding of our industry.
Now, did you come here alone from your place, or do you have other people?
I brought one of my managers.
So when you made that decision as to who would come, for the people that are not here, how did you break out that time in your organization? How did you make the decision to bring somebody else, and how are they being covered while you're not there?
So in previous years, I've been able to bring 3 or 4. But as all of you out there know, fourth quarter packs a punch. And so business-wise, I was able to bring one, and he's actually my newest leader. And I thought it was a really great opportunity. Another was going to come, but was ill. So, you just plan for it. The good news is it's really, unless it changes next year, it's always the first week of November, and it's good to carve out and, staff with your best charge nurses that week, or, whatever coverage you need to provide. But I think it's invaluable for a new leader. Like I said, the networking and just really connecting them to the profession and the industry, that it's bigger than just their job. So I think it's a key development piece.
Let's talk about that networking, because I always ask these questions during that the conference itself, the sessions are important, but really that's only half of the reason for being here, right?
It's only half, John. The vendors are great, really, really good vendor representation. And there's several half-hour, 45-minute mingle sessions where you can just go visit the vendors, chat with your friends, and just... there's a lot of venting that goes on. There's a lot of shared experience. Yeah. It's just kind of, it's just lighthearted. It's a lot more lighthearted than your day to day. And it's nice to get away while still, quote, working, who doesn't love that?
So the other great thing, first of all, we're a first time vendor here. We just, and I just mentioned to the board member who I interviewed just before you, that we made the decision at the last minute. I think we wanted to be a vendor, but we forgot to fill out the paperwork. So 2 weeks ago, we sent the paperwork in to be a vendor, and they accommodated us. It was incredible. And the experience here has been great. So, I think not everybody realizes how important that vendor experience, because first of all, you can go up to vendors that you probably wouldn't let in the door uninvited, right?
So true.
And then other times so you're meeting with people that are potential vendors to you, as well as the vendors that you already have, and maybe find out more. I know from our standpoint that when we do a show, we often get as much business from our existing clients who don't realize all the services that we offer. So if you're a vendor out there, don't shy away from those people that are already your customers, because they're your best advertisement for new customers here.
I was just going to say that, it is such a great opportunity to recognize your high quality vendors and, bring a friend over and do that on-site endorsement. That's, it's so authentic here because you're in person and you're able to just say, I've been doing business with these guys for a long time and they're so great. It's so good to see you. Give them a chance, or, have you met them? Or I think that's one of the biggest benefits to coming here, to be honest, because ASCs are so supply and materials heavy. Yeah. We spend so much of our budget on that. And so I think lots of conferences have vendors, but for us, I think it's very poignant just to be able to maintain those relationships and network with your vendors. And, I have 2 years ago, we did discover a new vendor here purely because of WASCA. So
we've had, and I have, this is only our first year as a vendor, but even my mingling with people as a vendor, as somebody that has a service to sell, but just walking around, found a great opportunity to talk to people here. So I encourage everybody to get a booth here. Absolutely important. But even if you can't do that, if you just attend, you're probably going to find an opportunity to talk to a lot of people. And so the vendor experience has been very good. I think that, to your point, it's very important for the attendees to talk to them. They do pay the bills, for this, and you're going to learn a lot more from for the people that you've never done business with, as well as those that you do business with.
100%.
So what's been your favorite session so far?
I really value the psychological safety talk.
Interesting.
Erica does a great job, and I've heard presentations before, but I think it's so important for leaders to really be checking into that on the regular. Yeah. Because people are harder now. Yeah. Managing people is just harder.
Absolutely.
I'm not going to, go into why that is, but I think everybody agrees. Yeah. We have different generational gaps, more so than ever. And I think just checking in to how you are leading and how that affects every single person that works for you is really key. And I really think it's something that you can hear regularly. So far, early in, that was my favorite today. So
yeah, I should point out that we're only halfway through the first full day. We had the
way to put me on the spot, John.
I know. Sorry
maybe
about
there's
that.
better presentations coming later. I don't know.
Well, we had the pre-con. So that's another thing that you're doing differently. This year you did a pre-conference. I spoke exclusively at the pre-conference, and it was really kind of heavily regulatory, like survey preparedness, both myself and the other speakers there. So I know you're going to continue that next year. It was very successful this year. So when you sign up, don't just sign up for the regular conference, but join them for the pre-conference to get some additional content also.
Absolutely.
So Alyssa, thank you so much. It's great to talk to the attendees here and let everybody understand what the experience is. And so what do you say to those naysayers out there that think that they can learn everything online instead of coming to a live conference?
We need to be people to people still. Face to face is still a thing, and it's really worthwhile.
It is. Thank you so much for your time.
My pleasure. Thank you.
We'd like to thank the association for giving us the ability to interview all of these attendees at the conference, and of course to provide space. They actually provided a dedicated space for us to do the recording. We very much appreciate the opportunity.
And thank you for tuning into this episode of the ASC Podcast with John Goehle. We hope you found the discussion insightful. If you did, please share it with your colleagues in the ASC community and be sure to subscribe so you never miss an episode. We appreciate your feedback and suggestions for future topics. Reach out anytime at comments@ascpodcast.com.
A special thank you goes out to our incredible team here, our sound editor, Susan Cronkite, executive producer, John Goehle, and our committed research team of Sue Cronkite, Jenna Alvarez, Judy D'Ambrosio, Michael D'Ambrosio, Zach Calritis, Jim Masters, Stuart Rosenberg, Amy Cronkite, Lori Rodericks, Kathy Foti, Donna Macchio, Christina Norman, and Katie Pearson. Your hard work makes this podcast possible.
Our theme music is by Media Sushi and Mike Noah. The ASC Podcast with John Goehle is hosted on Podbean and can be found on all major podcast platforms. Thanks for listening, and we'll see you in the next episode. This episode of the ASC Podcast with John Goehle is sponsored by Surgical Information Systems, RFX Solutions, MedServ, and Ambulatory Healthcare Strategies. Surgical Information Systems provides cutting-edge information solutions for surgery providers. RFX Solutions is your all-in-one healthcare regulatory compliance software. MedServ, which offers the only digital narcotics cabinet specifically designed and priced for surgery centers, helping develop standardized processes and compliance, eliminate paper logs, and prevent drug diversion. And Ambulatory Healthcare Strategies is the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, visit our website at ascpodcast.com. This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.